Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Jeffrey Bruno, PhD, is director of the Pacific Psychological Care Group. Their website is childwisdom.org, and they're located in Pacifica, California. He has a master's degree in general experimental psychology from the University of Wisconsin in Madison, and a doctorate degree in clinical psychology from the California Institute of Integral Studies. All right, sir, thank you so much for being here. It's a delight to have you.
Oh, you're welcome. I appreciate the invitation.
Can you start us off by telling us how you got started in the work you do and what drives your passion for it?
Sure. Well, I'm a psychologist by training, and my early introduction to psychology was actually through my father, who was an amateur hypnotist. And in high school, he mentioned that he used to do hypnosis and even did some stage hypnosis. And, as a young teenager, I was really intrigued. I wanted to learn more. He said, well, if you have any friends who want to, be hypnotized, I can demonstrate for you. And there was no lack of people who wanted to try that experience. And so we got a chance to really see a wide range. My brother and I got to see a wide range of hypnotic-induced phenomena, from sensory alterations, making a pin sound like a cannon, to having somebody be as stiff as a board and literally suspended between chairs with the back of their head and their ankle. And my brother and I would be sitting on them, things that just defied reason. And that really got my curiosity about what is this thing called consciousness. And it kind of really led me to look more formally into the study of consciousness.
And so what drives the passion for the work you're doing now? We've got you at childwisdom.org as your website. And one of the things that I was really interested in hearing about is the integrative approach. What drives your passion for this work?
Several things. One, I'm just always curious about ways to support the healing process, how to really discover the principles underlying healing, because I see healing as this great overlap between spirituality, consciousness, and really the relief of human suffering. And for me, mental health is an area of healing that really just begs for more innovative solutions. It's a somewhat of mental health as a whole, I think, is a little bit of a backwater of attention in terms of the healing professions. And I'm particularly passionate about finding alternative therapies, natural therapies, healthful therapies that support mental wellness. And so that's really been driving me for many decades now, just continually to try to figure out what's the best way to heal the mind, as well as feeling that the mind is instrumental to all forms of healing, that unless we really understand how our thoughts, words, and actions affect the healing process, we're really not paying enough attention.
I'm drawn to one of the quotes you have on your website from Dr. Andrew Weil, where he talks about the sorry state of the psychiatric profession these days, where they're pretty much relegated to just using a biochemical approach to squash symptoms. And when you're talking about all of these other areas of the human experience and bringing them into focus for healing, what are some of the approaches you use, whether it's tools or a format for therapy, to make sure you're in an integrative approach?
I do like an integrative approach, meaning I will embrace what works, whether it's traditional forms of psychotherapy or it's the use of alternative therapies like light and color, nutrition, oxygen therapies, auricular, ear acupuncture, or energetic forms of therapy. Being able to draw from a wide range of tools, and try to align those tools to the interest and what's needed by my clients. So really try to make it more personalized, to have a wide range of tools to draw from.
So are you trained to do auricular acupuncture, or?
I am. I was introduced to auricular therapy, which is a form of ear acupuncture, when I was doing my pre-doctoral training in the Tenderloin Mental Health Clinic by a psychiatrist who was using auricular therapy with getting people off methadone, heroin addicts, helping them get off methadone. And there's protocols for drug detoxification and pain management that she introduced me to.
So you actively use auricular therapy when clients come to you and you're applying it rather than referring it out to a practitioner, or?
Correct. I will use it. It's not the mainstay of what I do, but it's, again, another tool, particularly if there's pain issues, sometimes anxiety issues, sometimes can be helpful for managing insomnia and helping support depression, mood. Those are areas where I'll think about auricular therapy, and it's a very quick, easy therapy to add into a whole mental health approach.
Well, you mentioned, here we have creeping into the view, you mentioned nutrition, and you've written this book, Eat Light and Feel Bright, and it talks a lot about microalgae solutions. Can you tell us a little bit about how you got started in that and how much of that you're actually recommending for people in your work today?
I had almost like a dual track in terms of my training and interest. When I was back in my mid-20s, I was introduced to a naturopathic physician, Dr. John Ray, who was so far ahead of the time at that period. This is in the early 80s or mid-80s. He was already doing what now is referred to as energy psychology, using acupoints, nutrition, and psychological processing. And when I was learning nutrition from him, I asked him, well, what do you think is the best brain food that's around? And he said microalgae, and particularly a species of microalgae known as Aphanisamina flossaqua, or AFA, that is native to Southern Oregon. And I started using it and really noticed an enhancement in my memory, in my overall energy level. And so I was quite impressed. There's not a lot of things in nutrition where you notice a more immediate effect, but this was something with very small, a few grams of microalgae, I started to notice some benefits. And that led to almost a 30-year period of time where I've been not only daily using microalgae as part of my nutritional approach, but studying to understand how could it have such profound effects, not only on the brain, but other health conditions. So the book you're referring to, Eat Light and Feel Bright, Microalgae Solutions for Individual and Planetary Health, really is taking about 6 to 8, I think almost 800 studies were looked at and incorporated into that book to try to document the extensive health benefits of this unknown food. For most people, microalgae isn't really that well known, and the benefits that it can have not only for mental health, but actually for planetary health as well.
Well, and I was really impressed with the fact that there's basically 40 pages of references for your book. So you're backing up with all these studies, what you lay out in the book. So do you find yourself prescribing or strongly recommending strong diet changes for people that come to you for mental health issues?
Well, as a psychologist, as you know, we don't prescribe anything. That's really legally locked up in the realm of MDs and other licensed physicians who have prescribing practices. We can recommend, and I do recommend, lifestyle strategies, which includes microalgae as well as exercise and other supportive therapies. Yeah, with some of my patients and some of my clients, I definitely will.
And do you have an assessment process that you put people through, or is it an individual basis? Do you do any work these days? Have you been restricted to the telehealth realm?
Well, during this crazy COVID year, about half of my clients and sometimes more choose to do telehealth. I do see some people in person, and because some clients just aren't well served with online services, so I've continued to see certain people who've really needed that kind of in-clinic approach.
I tend to look at it as when there's a disruption in what was normal. I guess I got this from my parents. Look on the bright side, look for the opportunity, et cetera. And one of the things that happened right after I'd gotten my doctorate was HMOs and PPOs came in, and they wanted you to fix a person in 5 sessions. And then another PPO would come on and say, well, we can find therapists that'll fix that person in 3 sessions. And it really drove this work toward solution-focused therapy and brief therapy. And so one of the things that's happened with the coronavirus is that people have been forced to help people that they can't see face-to-face. So they're doing the telehealth. And they've been, for some, it's come up with some rather creative solutions to helping people through a Zoom call or through a phone call. And I just wondered if you had been able to do some of that and adapt some of the things you would do in person to the online or telehealth realm.
Yes, I'm doing my best with that. I prefer person to person in office visits over telehealth. However, there are some therapies that do translate well over telehealth. One of the therapies I use is called parent-child interaction therapy, which is teaching parents a form of play therapy, working with young children. And surprisingly, we were able to set up the Zoom video so I can watch the parents play with the young child. They wear a little earbud with their smartphone, and I'm able to coach them live. And the child really isn't distracted by being in the psychologist's office, so it's a more natural environment. And I have found that particular therapy quite effective over video services. I've tried to adapt some of the color and eye movement work that I do with video, and it's not as effective, but it is possible to project some colors and to watch people's eyes positions and do some eye movement. Sometimes I'll use some of the energy psychology methods, the tapping techniques like emotional freedom technique or different holding techniques that might be used, and demonstrate that and work with the person as they're applying the techniques on themselves. So there are some things that can certainly be done over the internet, but I strongly prefer sitting with the person. I feel like I get so much more out of that, and I think they get more out too.
And one of the hand positions you just used reminds me of the body talk and cortices tapping. Are you familiar with that work?
I've heard of it. I've never studied it.
It's a body of work that, just like all of these other energy psychology works, uses tapping, uses your breath, uses visualization of the energy flow, and some people find it very powerful. So as a supplement, when some people, and I teach the EFT tapping to people, if they're not liking it or they're getting a little stuck, I'll introduce the cortices tapping, which is very simple. It's easy to do. It's easier, and then they're empowered to be using this between sessions. And that's one of the things I like to do. Sounds like the same thing you like to do. Teach people to be empowered for managing their own mental, emotional, psychological, and spiritual health.
Yes, definitely.
So the way you get referrals most? Where do your referrals come from, or what are you most known for helping people with?
I have a reputation now that I've been doing this work for over 30 years for integrative mental health. And so oftentimes people who are looking for either non-drug approaches for mental health or integrative approaches where the therapies can be kind with medications that they're already on. And I really work with a pretty wide range of folks, from children through adults, and see a lot of the things that are typical for psychologists. Anxiety, depression, sometimes more severe mental health issues like bipolar disorder or psychoses. But also, because I work with children, I'll work with learning issues and behavioral issues, OCD. So just a range of different, typically mental, emotional issues that people come in with.
So the OCD sparks my interest when you talk about obsessive compulsive disorder. What are some of the approaches you find most useful for a particular area like that, which many people find intractable?
One of the more promising approaches that I've seen some really good results with. The challenge is, let me just step back a little bit. The challenge in mental health is, as you well know, that there can be a label thrown out there like OCD or bipolar illness or autism or depression or anxiety. And it's kind of like a snowflake that each person comes in with their own individual life experience, their own individual expression. And psychiatry is trying to categorize, or psychology as well, the insurance kind of asks us to do it, and put people into these categories. So the challenge with that is that when you do a particular type of treatment, it doesn't necessarily apply to everyone who's been labeled in that category. And so sometimes we find a certain treatment works great with one person with OCD, but another person comes in and it might not be as effective. That said, draw from cognitive behavioral therapy, that's been pretty well established for OCD in terms of the exposure therapy, or letting people know how to do different techniques to stop the compulsive or obsessive thinking pattern. There's some pretty well-defined cognitive behavioral therapies for that. And then I will combine that with a form of therapy called emotional transformation therapy, developed by Dr. Stephen Vasquez, which uses colored light. And we can adjust the flicker rate with the light as well. What that does is you can attune the particular emotion the person's going to, and there's so many varieties of OCD symptomology, and they can have different emotional underpinnings, that the combination of the colored light and the flicker rate combined with the cognitive behavioral therapy approach, you can disrupt the obsessive pattern. And because there's something called biological entrainment with light, particularly, that when you have the flicker rate going on and you're varying it, so you're almost like presenting a random presentation of different flicker rates, that it's hard for the person to stick with the obsessing. And so you really ask them to stay with the obsessive thought as you're changing the flicker rate, and it disrupts the pattern. And then you can actually help train the person to start to do that more on their own using cognitive behavioral therapy strategies as well. So this is an example where an integrative mental health approach, I believe, is more superior than just a standalone cognitive behavioral therapy, which is typically combined with medications, like SSRIs within standard psychology and psychiatry is considered the most, kind of standard of care. But we can bring in light and oscillating brainwave patterns with entrainment that also can disrupt obsessive patterns. And then we support that with good psychological care.
And the name of that therapy again that uses the light frequencies is what?
Emotional Transformation Therapy, ETT, by Dr. Stephen Vasquez.
And the way you're presenting it and the disrupting of the pattern reminds me of the bioacoustical utilization device. Are you familiar with that?
I'm not. No.
It's just a little set of headphones, and they've done some experimenting with the frequency of sound that'll stimulate the amygdala and produce that fight or flight or that startle response. And when the person is tuned into what their own thought process was or their memory is, that creates a discomfort or an anxiety or a physical disruption, and then puts the headphones on and it's tuned to that frequency with the amygdala, and then they disrupt it. And you're literally doing the same kind of thing you're talking about with the light frequency. You're disrupting the entrainment in the person that goes along with the thought that stimulates the amygdala, et cetera. So it's a lot of...
No, I would say there's a whole new generation of psychotherapies that are starting to use, one could say, neuromodulation techniques, whether it's tapping, whether it's bilateral stimulation or eye movements or auditory or light, adding this neuromodulation component to good psychotherapy skills and personal attunement relationship skills can really help clients move through things that just standard talk therapy by themselves, or I believe just medication by themselves, leave untouched.
Yeah, I have to agree. And I see that a lot of people, when they're stuck with the traditional talk therapy or the meds and the talk therapy, they're greatly relieved when somebody introduces something. Here, try this new thing, where you're actually engaging them in a process or sending them home with a tapping technique or some worksheets that they can be doing that empowers them to make a shift in what's going on inside of them. So what's another tool you have found useful?
Well, I would have to, talk about nutrition and oxygen therapies. And we could talk even a lot further about light therapies, but nutrition is so important. It's becoming increasingly recognized, but unfortunately, similar to medical school, graduate school in psychology, did you have one nutrition course when you were being trained as a psychologist?
Not a single one.
Yeah, it's same with me. And I went to what was considered kind of an integrative graduate program, California Institute of Integral Studies, but there wasn't a single nutritional course in the whole doctoral program. And so most mental health practitioners, most psychiatrists, most counselors really lack any kind of understanding of how nutrition can be used to target mental health symptoms and the importance of applying nutrition. There is a field in psychiatry, orthomolecular psychiatry, which I'm sure you're familiar of. Now it's called functional medicine, but really functional medicine grew out of an older tradition of orthomolecular medicine. And the remarkable thing is the brain is the most hungry organ in the body. So nutritionally, the brain consumes the largest proportion of calories, has the most oxidative risk, is most sensitive to glucose changes, and really can be affected by mineral imbalances, is incredibly affected by toxic metals, and exposure to environmental toxins. So the brain is super sensitive to nutritional excesses or imbalances, deficiencies, as well as toxin exposure. And we could quadruple that with younger brains. So children, because they have even proportionally larger brains, than adults. Actually, they are more metabolically sensitive, and they also have less developed blood-brain barriers and less developed gut function, more leaky gut potential risk, that they tend to be even more kind of like the canaries in the coal mine for our modern diet. So oftentimes nutrition is really a good place to start with addressing mental health issues.
And you talk about in your book the studies that indicate that the soil that we grow so many of our foods in, it doesn't have the nutrients in it. And so how are you recommending people supplement that?
It's a challenging one because even in organic food is oftentimes shown to be deficient in trace minerals, because if it's not in the soil, it's not going to be in the food. Ideally, people would eat, the best whole food diets they could, because we know that particularly processed foods, fast foods, tend to be even more nutritionally deficient in a lot of the essential factors. But oftentimes people do need to supplement, particularly if they're mental health conditions, because again, the brain is going to be one of the first areas to show when there's nutritional imbalances. Not surprising, because it's such a metabolic organ. So, before somebody would develop a heart condition or a liver problem or some other kind of diabetes, they're going to start to have mental health issues, problems of mood and performance and memory due to nutritional imbalances. That'll show up first. So getting back to your question, of course, I have a bias. I like microalgae. I think microalgae is the premier trace mineral food. It has one of the widest range of trace minerals. And it's also an incredible good source for protein and antioxidants and a range of other cofactors. So for me, that's kind of like the whole food multivitamin, good forms of microalgae. But there can be other ways to get good trace minerals as well.
All right. Well, I have the good fortune of having connected with somebody who's a naturopathic physician years ago, and he talks a lot about this body as an energy system and how important it is to eat whole, live, as much as possible raw food to increase the body's vitality, as well as the nutrient part you're talking about, but to increase the body's vitality so that I've got the energy it takes to process out some of these traumatic energies and emotions. And what most of us are raised to do in this culture is live at a low vitality level where we don't really have the bandwidth, the energy reserves to process through the negative emotions. And to process through emotions, I need to be able to keep my breath moving and allow myself to feel whatever's coming up. And most of us are trained to lock it down by holding the breath. And most of us are trained to run away from that feeling with one form of drug or another, whether it's caffeine or sugar or salty, fatty, sugary foods.
No, it is true. That's such a good point you raise. To be able to move through stuck emotions, past traumas, there is a energetic component that's needed. And oftentimes the health part of mental health is not being adequately addressed. And, really, if you want to heal emotions, you want to heal past trauma, raising one's health, which is oftentimes raising one's vitality, makes it more accessible to retrieve traumatic memories, process stuck emotions, and to move through it when you have those additional supports. So starting at that foundational level, I like to think that when you look at kind of a systemic way of looking at the nervous system, the gastrointestinal, the digestive system is our first nervous system. So if we look at a worm, a worm doesn't have a brain, but it does have a GI tract, and it has all these nerve plexes that are surrounding the GI tract. The GI tract is the foundational nervous system. And from an evolutionary standpoint, if we want to start, kind of at the bottom, we have to address the GI tract. I have this theory that I have been working on for a long time, and it's called the Genie model. And Genie stands for, addressing these different systems for mental health. Genie stands for gastrointestinal. The E stands for the endocrine system. The N stands for the nervous system. The I stands for the immune system. And the E stands for either environmental or energetic aspects. And so we need to actually address the whole Genie as mental health practitioners, because the immune system does affect mental health conditions. The endocrine system does affect mental health conditions. The GI system does affect mental health systems. And so it really does take a holistic approach if we want to definitely support people with the most severe mental health conditions.
Well, and I've had I think of your website, childwisdom.org, and I think about how many people I've had, preteen and teens, in the past year where they're coming for therapy and they're basically living on snacks they can get in a bag or a can and what they call energy drinks, which are just all the sugar and caffeine. You would never imagine how much caffeine. And I just, the struggle that I've had with these people to try and get the preteen and the teen and the parent to understand this is not a tenable situation. You can't keep doing this to your system and expect good results mentally, physically, or emotionally.
It is true. And one of the reasons there's been such a rise in mental health issues, and I know you've seen this because I certainly have, not only over the last few decades has there been an increased demand for mental health services, but the severity of issues are going to younger and younger ages. And the mental health system is being overwhelmed by a tidal wave of people who are having emotional difficulties, learning difficulties, mood difficulties. And it's largely in part because the environmental system isn't being adequately addressed. People are getting crappy food. People are not getting enough exercise. The lighting systems people are exposed to are creating problems. And the amount of stress going on is just escalated. And technology is not a substitute for natural systems that are designed, that we grew up in, and we really need to be connected to.
Well, and I was in my mind following along with you and going on to and purpose in life and connectedness to community, and a sense of that blank staring time that's so essential for a healthy adult, to have lots of blank staring time as a child. The fact that we have created systems to prevent our children from getting bored or being in that space that usually gives rise to the creative impulse, and the list goes on.
Yeah, no, there's definitely a need to do some corrective adjustments in terms of the way that society contributes to mental illness, and just drugging people. In America, we have the most medicated population on the planet with psychiatric medications, and kind of like Brave New World, Aldous Huxley's book. We can't drug ourselves out of this problem, as profitable as that may be to certain pharmaceutical industries. In terms of the toll on human life, there needs to be a return to more natural, wholesome modes of living that can incorporate technology, but you can't replace nature with technology.
Yeah, I interviewed a woman who's got a residential treatment center, and she was an art therapist in Europe, and when she came back over here was just floored by how many people are on these drugs, these really heavy drugs. And over in Europe, when she was working in institutions and hospitals, they had people with the same kinds of issues, but they weren't on all these drugs. And so she and her husband created this residential treatment facility to give people the alternative. Here's this, live close to nature and find things that can support you on your mental health journey without just drugging you incessantly. So there's a need for it. And I think one of the biggest challenges I face in my practice is to help the preteen and teen individuals understand that they have to take the bull by the horn, so to speak. They have to make changes in their life, because if they just go along with what everybody else is doing, the problem's going to get worse, not better.
Yes, it is true. And at some point, each individual has to step back from the popular culture and find that inner voice within themselves and find that inner sense of meaning, that inner sense of purpose, that inner guidance system that starts to direct them on a path of wholeness, on a path that really allows them to create the healing for themselves and their families and their culture and their community. Because the outer popular culture does not provide that. And you know, all the systems, you know, the insurance systems, you know, the medical systems and so forth are more designed to profit from human illness than to really find the solutions that help set people free. The most profitable, or the drug for a pharmaceutical company is going to be one that subdues symptom but keeps a person a long-time consumer of that medication, rather than really looking for a cure. Pharmaceutical companies aren't looking for cures of that type. They're looking for drugs that will keep a person a long-term consumer because of the clear profit benefits for them.
Yeah, and while some of those drugs, as we've seen, can be very useful in the short term to help stabilize somebody or pull them back from the ledge, Whitaker's book highlights how we've got an epidemic. And if these medications were actually curing depression and anxiety, we wouldn't have an epidemic of mental health problems.
It's true. I do want to say that in an integrative approach, it's not that I'm against the use of medications. I think there's a time and a place where medications can make all the difference, really can save lives, can be instrumental in helping people stabilize themselves and get to a place where then they can start to do other things to build upon their life. So it's not that drugs are bad, but if the only goal is to get people medicated and then step back from that and not allow, and not find other solutions and other ways to restore the healing process, that's a very short-sighted vision.
Well, I'm aware of the time, and I want to ask if you just take a breath and get centered and think about what's something about this work, mental health in general, or your practice that you'd like to get out here that I haven't asked you about yet.
I really would like to talk about the use of light as a mode of healing. And if we step back and think about the role that sunlight has on sustaining life on the planet, there really is very few life forms, maybe in the bottom of the deep sea by some sulfur vents, or maybe some organisms that can survive off that. But by and large, life as we know it has been shaped, defined, sustained by light. And so light can be a very, very powerful therapy. We know for seasonal affective depression that light, people are more at risk in places like Seattle or places where there's, less sunny winters. There's a higher risk of depression, and that these light boxes, which can be used for maybe 20 minutes once or twice a day, can often be an effective treatment for reducing seasonal affective depression. It's a standard care. However, most people don't realize you can use these light boxes for any form of depression. and depression in general will respond, because there's a mechanism where serotonin increases when melatonin is shut down. And these light boxes can really oftentimes give people, particularly people with depression in the mornings, it can really give them that extra boost. But light can do so much more than just treating depression. And we're finding that different frequencies of light, which can show up in the visible spectrum, like, red to violet, but even some of the farther, less visible forms of light can have profound effects. I've been using light in my practice and color in my practice for over 15 years, largely inspired by the work of Dr. Stephen Vasquez, who's been is a mentor for me. And what's beautiful about light is, in particular colors and eye positions, is you can help a person get into that therapeutic window. The challenge is that oftentimes people either don't have access to feelings or memories, or on the opposite end, they might be flooded by too much feelings or too much memories. And one can use, and very rapidly, can adjust the different frequencies of color and eye positions and a whole range of psychological methods where you can get a person into a place where the emotions come up, they can process it and do the type of work. And if a person's feeling too flooded, you can adjust the color or the eye positions, and you can help them get into a more grounded place within their body. And so I really feel that the use of colored light and light modulation and eye positions is one of the most effective neuromodulation approaches for mental health. And it needs to be a place where there's more research, needs to be more clinicians trained in this approach. It is so highly effective and so powerful, but gentle. And so with very little side effects, the proper use of color, light, eye positions with psychological methods really is the most promising area in mental health.
Excellent. Well, I look forward to looking into that some more, and I look forward to following your work. It's been an honor for you to share with us today, and you've got childwisdom.org as your primary website. Thank you so much for joining us here today, and let me know if you write another book and you want some help promoting it.
Thank you so much, Tim. I appreciate being invited onto the show and having this conversation with you. Thank you much.
Take care. Jeffrey Bruno, PhD, is director of the Pacific Psychological Care Group. Their website is childwisdom.org, and they're located in Pacifica, California. He has a master's degree in general experimental psychology from the University of Wisconsin in Madison, and a doctorate degree in clinical psychology from the California Institute of Integral Studies. Dr. Bruno specializes in child, adolescent, and family therapies. He offers integrative, holistic mental health approaches to support his clients' recovery of health. Dr. Bruno is a pioneer in the use of nutritional psychology and in the use of light-assisted neuromodulation psychotherapies to enhance mood, behavior, and performance.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.